Calculus removal stroke. The calculus removal stroke is used to remove calculus deposits from the tooth, a very short, controlled biting stroke, used to create a brief, short stroke to snap the deposit from the tooth. And, as with all instrumentation skills, each calculus removal stroke should be made in a step-by-step manner. A periodontal typodont with flexible gingiva is recommended when practicing subgingival instrumentation. Instrumentation of root surfaces within deep periodontal pockets is one of the most important skills to master. You will not be able to practice root instrumentation in a classmate's mouth. It is important to perfect this technique by practicing on a typodont before attempting subgingival instrumentation on a patient. It is not necessary to wear gloves while practicing on a typodont. In fact, it is helpful to work without gloves so that you can assess your grasp. Step 1. Get ready. Place the working end in the Get Ready zone on the middle third of the facial surface. Step 2. Prepare for insertion. Lower your hand and the instrument handle until the curette toe is pointing toward the gingival margin. Position the working end so that the face is hugging the facial surface at a 0-degree angulation. Step 3. Insert. Gently slide the working end beneath the gingival surface. The face should be hugging the tooth surface. Insert all the way to the base of the pocket. Step 4. Prepare for a calculus removal stroke. Gently slide the working end up the root until it is positioned just beneath a calculus deposit. Step 5. Tilt the lower shank toward the tooth surface. Establish an 80-degree face to root surface angulation by tilting the lower shank toward the facial surface. The face of a universal curette is at a 90-degree angle to the lower shank. This means that the curette face and shank are tilted toward the root surface to achieve correct angulation. Step 6. Lock on the toe third of the working end. Apply pressure with your thumb to lock the toe third of the working end against the tooth surface. Step 7. Make a calculus removal stroke. Keeping the toe third locked against the tooth surface, make a tiny biting stroke upward against the calculus deposit to snap the deposit off of the tooth. Step 8. Stop the stroke. End the stroke with precision by pressing down with your fulcrum finger against the tooth. Step 9. Pause and relax at the end of each stroke. Make a single stroke, stop, and immediately relax your fingers in the grasp. This lessens the strain to the muscles of your hand. Step 10. Reposition the working end underneath the calculus deposit. Establish a 0-degree angulation with the face hugging the tooth. Using a relaxed grasp and light stroke, position the working end underneath the calculus deposit. When making a series of calculus removal strokes, it is important for each stroke to be distinct and precise. One of the most common technique errors is the use of rapid back and forth instrumentation strokes. Notice how the working end moves back and forth, up and down, in a rapid manner. The clinician does not pause to reposition the working end after each stroke. These strokes are sloppy and will be very ineffective. And unfortunately, these back and forth strokes place a lot of stress on the clinician's muscles. So this method is ineffective and stressful. Correct technique for calculus removal strokes involves a series of separate, deliberate upward strokes. The clinician makes one tiny biting stroke upward against the deposit. Immediately, he or she pauses and relaxes the fingers. Next, the clinician makes a light stroke to reposition the working end. Prepares for a second stroke. Makes one short biting stroke, and repeats the process for stroke 3. This technique is highly effective for removing calculus deposits. As an added bonus, this technique places far less strain on the muscles of the fingers and hand. To summarize, each calculus removal stroke should be made in a step-by-step manner. One stroke is made at a time. Each calculus removal stroke should be distinct and precise. And the clinician should pause and relax the hand after each stroke.